Sleep is a behavioral state characterized by inactivity and reduced responsiveness to external stimuli. Sleep disordered breathing involves a collection of medical disorders characterized by intermittent disruptions in breathing and gas exchange during sleep. Three patterns of cessation of breathing, that is apnea, can be observed during sleep. During obstructive apnea, respiratory efforts persist although airflow is absent at mouth and nose. Obstructive sleep apnea is characterized by recurrent episodes of partial or complete upper airway obstruction during sleep. A central apnea occurs when both airflow and respiratory efforts are absent. A cessation of respiratory effort at a brainstem level occurs in central sleep apnea. Many adult patients exhibit apnea in which both central and obstructive pattern occur, which is termed mixed apnea. In the same night, patients may have central, mixed, and obstructive apneas. Obstructive sleep apnea has some risk factors like obesity, aging, alcohol, nicotine, male gender, crowded airway, thickening of the lateral pharyngeal wall, neck size, and familial predisposition. Central sleep apnea may be hypercapnic like obesity hypoventilation syndrome or Pickwickian syndrome, and non-hypercapnic like idiopathic central sleep apnea and chain stroke respiration. Chain strokes is usually associated with congestive cardiac failure. Sleep apnea has been associated with snoring, witnessed apnea, choking, restless sleep, morning headaches, excessive daytime somnolence, and occasionally impotence. Sleep apnea may predispose sustained hypertension, diabetes mellitus, coronary events, arrhythmia, stroke, pulmonary hypertension, and even road traffic accident. Besides sleep apnea, there are also some other disorders of sleep like narcolepsy, parasomnia, REM sleep behavior disorder, restless leg syndrome, periodic limb movement syndrome. The gold standard to diagnose sleep disorder breathing and some other disorders is polysomnography. A standard polysomnography comprises electroencephalogram, electroocologram, electromyogram, cardiopulmonary monitoring of airflow, respiratory effort, oxygen saturation, heart rate, body position, and sometimes carbon monoxide monitoring. A split night polysomnography typically includes 2 to 3 hours of diagnostic monitoring followed by CPAP titration if a threshold frequency of apnea, hypopnea is exceeded. If you have sleep disordered breathing or other sleep related problems, Square Hospital provides the perfect solution for you. Square Hospital owns the most advanced sleep lab ALICE 6 LDX system. ALICE 6 LDXN diagnostic sleep system is the ultimate system to perform polysomnography, which pair the LDX base station with the LDXN headbox to have a full-featured, easy-to-understand system that allows to focus more on patients and less on equipment. It has full 32 EEG input. It has dedicated differential process transducer and keyhole inputs, which reducing the number of connections during hookup. This system meets or exceeds American Academy of Sleep Medicine standards. Renowned consultants of sleep medicine in Square Hospital are using this cutting-edge sleep diagnostic system to pinpoint the exact causes of your problem and will prescribe the most precise methods of care. Sleep Lab ALICE 6 LDXN has diagnostic abilities for all sleep-related diseases such as obstructive sleep apnea, central sleep apnea, mixed or complex apnea. Our 1020 EEG system enabling comprehensive sleep analysis. We have ability to diagnose neurological disorders like periodic leg movement, idiopathic hypersomnia syndrome, narcolepsy, epilepsy. Our capnographic carbon monoxide monitoring can confirm obesity hypoventilation syndrome. Complex cardiac abnormalities can be identified. Thus, all these disorders can be well managed in the setting of Square Hospital. We perform split night study with appropriate titration. Our ALICE 6 LDXN enables all kinds of titration with various modes like continuous positive airway pressure, auto CPAP, bilevel positive airway pressure, average volume assured pressure support, spontaneous timed or timed modes, and auto servo ventilation modes.